Hi guys, I'm Tomiko from Tomiko Advisors. I'm going to share with you guys important updates in hospitalization coverage in Singapore. And I will zoom into AIA Singapore Shield changes, specifically private hospitalization coverage. But little disclaimer, this is not the official video from AIA. From 1st April 2021, all integrated plan rider will require a minimum of 5% co-payment, including renewal of the existing integrated shield plan with full riders. This change has been welcomed by the Ministry of Health (MOH). One of the main reasons is medical inflation. Medical inflation is relatively high year by year. In 2020, Singapore's healthcare inflation was 9.3%. Claim-based pricing. Some insurers have also introduced claim-based pricing. This means that policyholders who make certain claims will subject to premium increment in the following years. The companies that adopt this claim-based pricing are Prudential, Great Eastern, and also AIA. However, for AIA Singapore, there is option for policyholders to go to non-claim-based pricings. Regarding the claim-based pricing, there will be a no-claim discount too. A policyholder that do not make any claim will enjoy a discount of their insurance rider premium. Let's see the changes in AIA Shield that cover private hospitals, since most of the changes will in private hospital coverage. Changes in basic shield plan. No proration for admission with non-panel doctors. It means before the changes, AIA will not cover 15% of the bills if policyholder went to non-panel in the event of non-emergency and without pre-authorizations. After the change, AIA will not have proration but will highly encourage to go to panel doctor still and with pre-authorization if possible. I will share more detail about benefit of panel doctor and pre-authorization in another videos. The second change is for the new treatment cell tissue and gene therapy. From 70,000, the coverage will up to 100,000. Third change is inpatient hospice palliative care treatment. Fourth change is premium adjustment of around 20%. Please refer to the premium notice regarding the new premium for the basic shield. Now, regarding the rider, there are two riders. One is Vital Health, that is no claim-based pricing, and Vital Care, that is claim-based pricing. If you are under Essential A saver, your policy will automatically convert to Vital Health. But if you are with Essential A, your policy will change to Vital Care, which is the claim-based pricing. Vital Health. With deductible waiver pass for the first private hospital claim or when there is no private hospital claim, admission or day surgery in the last 3 consecutive policy year, the deductible waiver pass is applicable to subsequent claim occurring in the same policy year as the first private hospital claim. With deductible waiver pass, AIA will cover the deductible and co-insurance as incurred under AIA Health Shield Gold Max subject to 5% co-payment. So policyholder will need to pay the 5% co-payment. Without deductible waiver pass, other than the above, if you don't have a deductible waiver pass, there will be a $2,000 deductible that is not claimable. And on top of the $2,000 non-claimable amount, there will be a 5% co-payment. Will the 5% co-payment cap at $3,000? The 5% co-payment per claim on the eligible medical bill will be capped at $3,000 per policy year if the admission or treatment is by AIA preferred provider or non-AIA preferred provider with pre-authorization. Is it confusing? I believe so. I was confused too at the beginning, but no worries. Let me elaborate more and give you example. Let's say for example, you stay in a private hospital with AIA quality healthcare provider or non-AQHP with certificate of pre-authorization for the first time. It means you will have deductible waiver pass and AIA will cover all the bill except the 5% copay, which will be capped at $3,000. That means the maximum amount policyholder need to pay will be $3,000. And if assuming subsequent policy year, you need to admit again in private hospital with AIA quality healthcare provider or non-AQHP with CPA, then there will be 2,000 deductible not claimable plus 5% copay that will be capped at $3,000, meaning the maximum amount policyholder need to pay will be $5,000. Please take note that it's policy year and not calendar year, yeah? It means if your coverage starts 1st February, policy year means from 1st February to the following year. After 3 policy year without any private hospital claim, you'll be entitled again to have your deductible waiver pass. Are there any other sources to pay the co-payment? The good news is yes, there are. There are 3 other options that can help you to pay the co-payment. First option is company group insurance. If you are working in a company, your company might able to cover the co-payment, but subject to the room entitlement or the hospital entitlement or the benefit limit. For the details, please refer to your company or your HR. Second, personal accident plan with accidental medical benefit, assuming the hospitalization is because of accident. Third option is MediSave. For Singaporean and PR who has MediSave, you can utilize your MediSave to pay the co-payment, subject to certain limit that is stated in Ministry of Health website. How if you are treated in private hospital with non-AQHP without CPA for the first time? So you will have deductible waiver pass. Therefore, AIA will cover all the bill except the 5% copay. However, the 5% copay will not have any cap since you are treated by non-AQHP without CPA. And if assuming the following year you are admitted again in private hospital with non-AQHP and without CPA, then you will not have any deductible waiver pass. Therefore, the 2,000 deductible will not be claimable plus the 5% copay. And since you are treated by non-AQHP without CPA, the 5% copay will not have any cap. So Tommy, can I avoid the 2,000 non-claimable deductible? The answer is yes, provided the admission is in government hospital. So no matter how many times the admission in government hospital, the 2,000 deductible will not apply. So you only need to pay the 5% co-payment. But beside these benefits, the rider has additional benefits too, such as immediate family member accommodations, post-hospitalization, alternative medicine benefit for cancer or stroke patient, post-hospitalization home nursing benefit, and home palliative benefit. And also early detection benefit for colonoscopy starting age 50 and also mammogram for ladies starting age 40. Beside that, emergency and outpatient booster will automatically added in. It will cover emergency outpatient treatment because of accident up to $2,000 per policy year, post A&E treatment, ambulance benefit, outpatient treatment because of HFMD or dengue fever, emergency medical evacuation or repatriation, emergency international medical assistance also included. Okay, that's a lot. I hope you are still following so far. So let's take a look at the other rider, which is Vital Care, which is claim-based pricing in nature. And Vital Care is simply covering deductible and co-insurance except the 5% co-payment. And the 5% co-payment will be capped at $3,000 when the admission is made with AQHP or panel doctor or non-panel doctor with CPA, Certificate of Pre-Authorization. And on the other side, if treated by non-panel without pre-approval or pre-authorization, the 5% will not be capped at $3,000. So how's the claim-based pricing work? So here are the video explanation from AIA Singapore regarding the claim-based pricing.
With claim-based pricing, you can now control your premiums based on how much you claim from AIA Max Vital Care. Claim-based pricing is a fairer approach that rewards you for being prudent in your use of healthcare services. There are 5 premium levels in claim-based pricing, starting from standard level, followed by levels 1 to 4. Your premium level moves up or down depending on the source of the claim, and the claim amount paid by AIA Max Vital Care during each policy year. When there is a private hospital claim amount of $1,000 and below under AIA Max Vital Care, the premium level will remain unchanged. The premium will move up 2 levels when the private hospital claim amount is between $1,000 and $5,000. And should your private hospital claim amount under AIA Max Vital Care go above $5,000, the premium level will move up by 4 levels with a limit at level 4. Your premium level will move down by 1 level when you seek treatment from a public or restructured hospital or when there is no claim. The lowest premium level is standard level. You will enjoy a discount of up to 25% on your standard level premium if you do not make any claims from AIA Max Vital Care.
They are the explanation regarding the changes of AIA Shield Plan and the 2-rider option. Hope is beneficial for you. You can check with your financial services consultant or comment below or reach to us or through our social media channel if you have any question or queries. Lastly, please like, share, and subscribe to our videos and channel, yeah? See you on the next video and have a good day. Bye-bye.